like the mucus and all that stuff, because that's what was.
I hadn't figured it was kind of mucus because right before like
You can
the
tell,
period,
right?
Like, why is it like that?
Right.
I just don't think about it.
Right.
Okay.
So that way it's more specific than like in like grade school they just say like, well, just don't do this or don't do that. So here's all your classes.
They say that in grade school.
They say go ahead and have fun.
No, they be like, I think my freshman class teacher, he was like, if you're going to pass day, make sure you get him tested first.
Oh.
Look at the results.
Ooh.
Then do that.
Interesting.
Yeah, and then even at that we're a condom.
Right. So that's and we'll get into that today again. But here's all the classes you could take online. Say you want to do philosophy, Psych 1200, and Social 1100. Those are all online.
I take philosophy.
Yeah, that is critical thinking.
Critical thinking was
the worst.
Depending on the teacher you had.
So I feel like most of these are online.
It wasn't hard. I had Amber. My mom was in person.
Amber Heard?
Nah, she got Mullins. She got a.
Oh yeah, that dude's wife up there. So Amber Heard.
I think I finished my genogram.
That's good. You got 3 generations. You got some of your like details, biological, who finished college, who's got.
Oh, you got to do the who finished college too.
I mean, that's one. Like, the more details, the best. But no, what I just saw, you're
this
definitely
is exactly how it's supposed to look.
Right. So that's like your people, and then people have like a key, like if there's heart disease in your family, if there's cancer, if there's alcoholism, who got divorced. So it's just to talk about client stuff. So it's training you. That looks good though. You're doing good.
Most of the people on my mom's side of the family are married.
That's what happened to my mom's side,
So
but
like, is there a signal or like a sign that you put like who went to college and did it?
You could make it up, but yeah, you could even number code it, color code it. You could be like 1 went to college, 2 went to, you know what I mean? Or you could be like green went to college, blue got cancer, red. And again, it's just so you guys work real good with your clients. So like when you're asking them all those questions, like the history, which I try to do with classes too. So if you want to go online next semester, just pick 5 of these, right? Because only the 12, I feel like some of these are in person on social work or in-person degree, but they do have like 2 or 3 of these online. You just have to like look. Have you done, so you've already done 60 hours? Huh? Yes. There's only 2 credit hours. So that could be online. That might be online. Sociology's online. Psychology's online. Critical thinking's online. I think history is. Math could be. English. Like it depends on, if you select your semester wisely, you could like live at home from January till next August. Just take 5 online classes and then do all the social work ones your junior and senior year. Or take 1 online social work one if you see it, So there's a way you could do it if you really wanted to. Save you some money living at home. $5,000. So do you guys have any other questions about your check sheet? You guys are all kind of finishing timely. I always go over it every class. So I'm like, you'll memorize this before we finish class here. Oh, we're talking about babies again. Holy junk. They give us all these notes. Did you see that? Interesting. I didn't realize they had all these notes on the side. Yeah.
We on the YouTube live and stuff. We screenshot the
stuff. You write it in. Yeah.
I'll just make sure. Last time.
Yeah, that's fine. I have heard that. Sometimes it'll say. I feel like that's why it's like encouraged to come in person, but there is the online piece. I'm glad we're not fully accredited online, like you were saying, because we're still working stuff out. Do you guys know how to get rid of these things? Do you just go like this? Huh. Okay. So everybody here knows how to either get pregnant or not get pregnant, right? That's kind of the gist of it. How to avoid having a baby. 10 days, you're fertile, and I guess mainly because the sperm lives there 10 days, and then you're fertile for 6 or 7. When you're having the baby, so we're jumping way ahead real fast to the stages of labor. So like, I remember my wife, we went in because her water broke, and that's interesting. So we went in, they said this water was leaking out, so we had to deliver the baby right away or it would die. So I think they induced her in that way. Basically, the cervix opens up, and then you're able to, they say you're like 2 centimeters dilated, then 4, then 10. I think 10 is what you want for the baby's head to fit through. Baby comes out first, then the umbilical cord, and then the placenta. And it could take like 10 minutes to 3+ hours. Well, the first stage is 12 hours. So I feel like my wife did the 12 hours. It took forever to have our first baby, basically. It took forever. So somehow we survived it. Here's your average birth weight. So newborns are usually 5.5 pounds minimum. So we found out yesterday, she said our baby at 21 weeks is 1 pound total. And that's 8 days ahead of where it's supposed to be. So if she's due on January 7th, they think New Year's Eve will be her birth date. And that's good, as we get a tax write-off for the whole year. If it's born on New Year's Eve, the whole entire year, they count that baby as yours, and they give you like a write-off on your taxes. She doesn't care about that, but I care about that. Think about it. It's like, I think it allows you to make an additional $5,000 without paying taxes on it, which is good. What's that? We're all here today. Or online. We got Lyric Lewis online. Videos. I wonder if they even have. All right, so this is what happens right after the birth that we were kind of going over. Oh, don't make me agree to cookies. Don't you think they would give you a cookie if you agree to cookies? Like, I don't understand what cookies are. Anybody IT here? That's a big baby. Here's what happens right when you're born.
Immediately after your baby is born, you'll notice your baby may be very wet and covered in some really thick, creamy substance known as vernix. Newborn babies aren't washed immediately because we want them to keep their temperatures up and stay nice and warm with their mum.
So it looks gross, but it's really important to keep that mucus on the baby because it has all the good bacteria. They've linked it to like better health outcomes if you don't wash the baby right away. They wait like 1, 2, or 3 days to wash it and like circumcise or whatever they do.
Midwife will deliver the baby onto your chest. This is known as skin to skin or skin on skin. It's the best place for your baby to be.
So they had me do that. I had to hold them like, they get to learn you and your smell, and they already know your voice because they can hear it in the womb, which is kind of cool.
Because it helps your baby adapt to life outside the womb. And this also helps the baby get ready for its first feed. If you have a cesarean section, you will still be encouraged to have your baby skin on skin. The midwife will offer you an injection to help deliver the afterbirth, or the placenta as it's commonly known. The umbilical cord will be clamped and cut. You might want to consider who's going to cut the cord. Sometimes your partner will want to do this.
I hated doing that.
Your baby will need to be examined. They may need a little bit of extra help just to start breathing. There should be very little time where you and your baby will need to be separated. Unless your baby is born at home, Your baby will need to be uniquely identified to you. This is done with 2 white name bands, normally put one on an ankle and one on a wrist. Your midwife will also advise you about giving your baby vitamin K.
So you know why they give you the armbands on the babies? It's kind of sad. Actually. They mix them up. What were you
No, I
going
was
to
gonna
say?
say so they can match with their moms.
Like they've lost
Yeah,
babies
they
in the
be-
hospital
Giving
before.
people the wrong baby.
It's crazy. So I was like, really? You're that bad? Like, so
Yeah.
I'm taking home somebody else's baby?
Hey,
Okay.
this is an injection, very small injection given to your baby to help prevent a bleeding disorder. You may need some stitches after the birth of your baby. This is done whilst you're still in the delivery room,
That hurts.
still having a cuddle with your baby to distract you. Your baby will need to be checked by a pediatrician or a specially trained midwife. This newborn check is important to make sure your baby is fit and well.
So there's that. That is a huge baby. I don't know. That's probably a 10-pounder. So usually they're 5, 6, and 7. That's what ours have been. My mom said I was 9 and my brother was 10. I guess that's what my brother looked like. That means you were born like at the 42nd week, which is, healthy. But that, I think for mom, it can hurt more. So it all depends. So there's a few things on like low birth weight and all that. The first 5 minutes after birth, like your heart rate, breathing is key. Is like when our son was born, I feel like he couldn't breathe. You just heard like he was COVID or something. He was like, and they had to like do something to like suck all the mucus out, and then he started breathing. I was like, you sure he's not going to die right here? So he was okay. They have ways of scoring them. So like if you're a social worker and you hear they had an APGAR scale of like 5, that could mean they need a medical intervention. And if it's lower than that, it's like they have a neurological problem. Some of the hazards are like you have all these complications in pregnancy. So frequent vomiting or vaginal bleeding that can lead to spontaneous abortion in early pregnancy. That was one we had last year. Vaginal bleeding in later pregnancy could be placentia previa, and that's when the placenta separates from the wall of the uterus. We also had that. We thought we lost the baby on the first one. We didn't. It's just that like the baby comes detached and then attaches back on, and it bleeds, and you get like crap out in the toilet, and you're like, "Whoa, did I just pee my baby out in the toilet?" And the answer was no. Our baby was still alive, and we didn't have to freak out. Or they could have toxemia, eclampsia, high blood pressure, gestational diabetes. They're testing my wife for that now, as they said the baby weighs so much. It's at a pound for 21 weeks. And so they give you this big sugar drink and see how long it takes you to digest it, like how much sugar is still in your system. And if it's not digested well, you could have what's called gestational diabetes. And the last one's like intrauterine growth retardation. So the maternal age, this is what's ideal. Now, obviously, I'm playing the bad guy and we're old. I'm 30. My wife is 37 and I'm 45 next. So they call us a geriatric pregnancy. So ideally, you want to have a baby at 18 or 35. Which one would you guys pick if you want a baby? Like sometimes the man's a little older, and he can be a little older. But when they're born, you got to chase them around. So you want to be like ready to chase them around. So 30 wouldn't be bad. 25 isn't so bad. You think 30 is too old?
For a first, yeah. I'd like to
Okay.
be on my second, like 30.
Right. Most people do. I mean, my wife and I were a different story, and everybody has different deals that they go by. When you are pregnant, all you need is 300 calories extra per day, which was shocking to me. I thought I could buy her like whole pizzas and 12 donuts, but it's 300 calories a day and only about like an extra apple or two. I was like, what? An extra apple? What is that? So, and that's saying you want to try to get a lot of vegetables. The last 3 months, you want a lot of protein. So if that's turkey, steak, tofu for vegetarians. And then multiple gestations are riskier and have younger gestational ages. That's like with maternal stress and illness. And then you could also have sexually transmitted diseases. So this is a big one to know because 80% of America has cold sores. If you guys have ever heard of a cold sore, it's like the side of your mouth. That's virus. Simplex 2 is genital herpes, but it can be transmitted all 4 ways. Like it can be passed from any mucous membrane. It can be passed to the vagina. It can be passed to the penis and can also be passed back to the mouth. So if you have that when pregnant, they usually do a C-section because if the baby went through the vaginal canal with herpes, gets it all over. What's that? It's better not to pass the baby through herpes and have it exposed. So that's, and 80% of us have cold sores. You might not see symptoms of it, but it's just like a very common illness and it is transmittable like to the genitals. So it's something to be careful if there's an outbreak. Biophysical hazards, drug use, teratogen is any substance that causes a birth defect. So the first poop the baby has shows 9 months or 7 months of the mom's drug use. So the baby doesn't poop, I guess, the whole time it's in the womb because the umbilical cord has taken away all the waste products. So when you cut that umbilical cord and the baby has to poop, that's like everything that was taken into the body for 5 or 7 months. Now, if there is heroin, sometimes the baby's taken and mom has gone into drug and treatment center. Have you guys seen like either a crack baby or a heroin baby? So they have to kind of detox. Oh, I didn't know it was a whole movie. Or is that a song by somebody? Is that a song? Crack baby? I've never heard of that. So that's more the 90s, but nowadays, oh, it is a song. That's all that's coming up. So here's like something with crack cocaine. Now it's heroin, so I'll show you this one as it's only a minute.
He said he'd love me forever if I smoked crack with him.
You got the money? Why are you asking?
He said he'd love me forever if I smoked crack with him. He lied. Find out the truth about crack.
So that's a little dramatic. I like the. So now the big one is the opioid epidemic. So if I can spell it. And there's a lot of research on this because I don't know if this one's going to show. What's that? The crackhead? He got away, dude. He was like, see ya.
I'm one of the pediatric physical therapists for the acute care therapy team. Our role is to help patients and families improve their developmental milestones and to help their level of functioning and help parents and families take care of their loved ones so that we can get them home. So with a patient with NAS, I'm really working on trying to help the baby feel better. There's a lot of research out there about infant massage and the benefits that it gives to not only just the baby, but the mother and the infant family dyad. And so infant massage really helps the baby.
So that sounds like a specific intervention for opioids, which takes a lot of like, they'll have to rock the baby. One person's job is just holding it and rocking it for a lot of hours through the day with maybe this one shows like, I hope it's not like that last commercial, but it probably, well, yeah, so that's what the baby would look like when it's going through withdrawal. That's what the baby kind of does. And until it's off that heroin, it doesn't stop that shaking, which is kind of crappy that, you know, they weren't totally, it's hard for the mom as she doesn't always get the chance to quit, and then hard for the baby as they have to be detoxed from it. And that's with our opioid epidemic in America, mostly real bad in Ohio right now. So as social workers, we kind of look for signs if that's happening. You can often see it in their first poop if there's opioids or even weed. When I was working at Claremont Recovery Center, there's a girl tested positive for weed with her baby, and she was 17, and they locked her up, and the baby went to CPS. So I don't know how that works now with like the prescription cards. You know how you can get like prescribed weed and whatever, and I guess you would have it in your system. I don't know what that looks like. I guess you would have to show it. Yeah. And then you'd be surprised how many people are in jail. Like, have you heard of that Russian basketball player?
Mhm.
Like, I don't know how long she's staying in, but it seems like a long time. Yeah. And she just had like a vape. You know, it was probably like her prescription at home. And she said she forgot and went overseas. So, I don't know. Uh-oh. You guys okay? So if this one wants to play, I'll go ahead and play it. Interesting. It might not today. But I think that first picture kind of shows it all. This is what that withdrawal, like if a baby is exposed to heroin, that shaking is constant until they're kind of detoxed with different means and whatnot with this fentanyl coming through. Let's see here. Have you guys heard of fentanyl? So that's the one thing they're kind of concerned about with weed being sprinkled with it, I guess. I didn't know that was the new thing. But sometimes they sprinkle when it's just like a granule of fentanyl on freaking weed. And all you need is a speck the size of a piece of sand, and that can kind of mess up things. Okay, here it is. We had a bunch in Cincinnati come through the weed in Cincinnati, and it was an issue. So we'll see 30 days of heroin in Cincinnati for one of our videos. Does the internet stink here sometimes? Does it? Maybe that's what's going on. Huh. So that is the first blood test for drug use. So it increases the chance of your miscarriaging. You could have low birth weight, cognitive abilities. Drug use can cause addicted infants. They have difficulty actively engaging. This is the same for alcohol. So if you guys know anything about fetal alcohol syndrome, they used to say like 1 or 2 drinks was okay. Now they're finding out it really is best to just avoid alcohol completely while pregnant. So yeah, alcohol is the biggest preventable cause of developmental disabilities. We may have some fetal alcohol syndrome babies. I don't know why the internet sucks today. Fetal. So you have like facial features and different things that show up
If you're in Ohio,
if they have fetal alcohol syndrome. And that could be with small amount of drinks.
He's judged people like me. Growing up, I thought a woman who drank while she was pregnant was just about the worst kind of monster there was. Hey, now, we have to stay away from the camera, okay? It's just going to look at you.
Natalie, what's it like to be you?
I'm 6. Are you ready?
I'm ready. Are you ready?
Yeah.
What do you want to tell everyone?
I want to tell dinosaurs
All right, tell them about dinosaurs.
because I like the loneliness.
before Natalie came into my life, I was a mess, and I was drinking on a daily basis. And she was born at 28 weeks, so about 3 months early.
What's the best thing about Natalie?
She's the best sister I've ever had.
So it can come out in like behavior disorders, you know what I mean? Like it can cause cognitive functioning. A lot of times the face is elongated, and it does, I mean, obviously it does create birth defects, as you can see.
I was planning on giving her up for adoption because I couldn't take care of myself, so I certainly couldn't be responsible for taking care of somebody else.
What's your favorite thing about dinosaurs?
The Tyrannosaurus Rex.
What does he say?
Since the day she was born, that idea was never spoken of within my family. Like, we never revisited that subject.
We feel like we're friends, not sisters. But we're sisters. And that we're sisters.
I can't
It
tell
was
who's
in the
older.
NICU for 3 months from when she was born, and so during the first month I went back to rehab.
If you could tell the whole world one thing, what would it be?
Horse.
You're a horse?
Every day I'm grateful to be alive. She saved my life. And then her sister came along, and we just became a fun little family.
Oh, so she's
La la
older.
la 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 la. La 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 la. La 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 la. La 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 la.
So that's one kid who's had fetal alcohol syndrome, but they're saying there's a spectrum. Some you might only see it in behaviors. Some you might see it in like their nose. Some you might see it in the way they behave. So something to consider there. This is what we'll watch next week. You guys might have already seen it if you had me in class. 30 Days of Heroin in Cincinnati. Do they still have it? Yeah. Oh, here's the trailer for it. I'll give you the trailer today. It did win a Pulitzer Prize, which was impressive. Hello.
Hello.
How are you?
Good, how are you?
Good. All right, I'm going to try this trailer for it. Oh, you were on it? You didn't know fetal alcohol syndrome could cause those behavior disorders, did you? What the heck? I don't know why it doesn't have audio today. I swear you can find one thing after another. Interesting. So those are, they do prenatal testing and then like drug testing to see if you have any of those abnormalities. Which kind? I don't know. I might. You just died and you're trying to say, girlfriend, I'll be out of class in 10 minutes. I'm almost. What's that? It is a weird dependency, isn't it? You're like, oh my gosh, I'm naked. Where am I going to go? How am I going to like do anything? Which I get it. I never thought I'd have that experience, but I probably left it up in the room. Oh, I got my chicken's food. I forgot that from yesterday. I got to feed my chickens. Crust. Pizza crust. Yeah. Yeah.
They egg-laying chickens?
That's why I got them.
My summer camp. They're so cute. You have the big fluffy ones?
They would let you hold them?
Yeah.
That's nice. See, that's why she came right when you asked. Does anybody have an iPhone charger? Please. Please. I just eat them for eggs. because I've been vegetarian. Now, my mom said, I'm only buying you guys a swing set if you get rid of the chickens. And we already bought the swing set, and I said, cool, I'll cancel the swing set when I get home. She's like, no. Okay, all right. Well, I'm keeping the chickens at least a little longer. Because they smell, the neighbors probably don't like them, all of that stuff. I have like a half an acre. So we're in like a suburb with solar panels, chickens, geothermal, and it's kind of fun. You guys know what the ultrasound is? Anybody had an ultrasound here before? Because you get them for injuries too. You got one for injury? You got the ultrasound for like a sports injury? Right. Oh, yeah. I get those a lot. And I guess you only get rid of those by drinking a ton of water and lemon juice or lemonade. They can, but you have to have yours removed. So you're able to flush it. So if you drink enough water and lemon has acid, it'll break them down and you just pee them out. It's usually too much calcium deposits and too little water. So if you're not drinking enough water, like hard substances accumulate in your kidneys. But if you're always drinking like 2, 3, 4 of these a day, you're probably going to be okay. But I drink one that big of coffee, and that also could probably cause it. And you didn't hydrate much, right? And it hurt, didn't it? Because like you bend, it's like, oh, you think it's a back problem, and it's actually a kidney stone. Right. Well, yeah, you'll feel it, and I'm like, I better chug like a lemonade this big, and I just chug it. So you do ultrasounds for kidney stones. You do it for like other sports injuries. You guys will get them if you're. My wife had one yesterday, and that's when they found out the baby's like 8 days ahead of time right now. Like it's too big, which is fine. It just will come early. And she has to take the diabetes test. So like towards the end of whenever the baby's bigger than a pound, you have to take the diabetic pregnancy test. You drink nasty sugar, and then they test either your blood or your pee and make sure you digest it. And if you don't digest it properly, they give you like some medicine. So other things they test for, especially because she's old, she's 37. They count it as, it's not that old, but they call it a geriatric pregnancy.
Are you serious?
Yeah.
At 37?
At 35. So we've had all babies at geriatric status. So we're geriatrics. They test for all of this. So like, I can't even pronounce some of them, but you could have amniocentesis, chronic villus sample, timing and safety of administration of the test is important. Non-invasive testing is good. DNA analysis, that's how we found out it was a boy. So now at 8 weeks, they pull your blood and say if it's a boy or a girl. In the old days, you had to wait till 20 weeks, and on the ultrasound, you see a penis or a vagina. But like now, they can do blood tests and know right away. Yeah, it's kind of cool. What's that?
A blood test is great.
There's a blood test at like 8 weeks. We bought it the first time because she was 34. What year did we have the baby? She was born in 86. So I guess, yeah, the second baby was geriatric, and they give you free tests.
So, okay, y'all don't ever do like gender reveals?
We did.
Really?
We did. We have a couple of those. I could try to look it up if I tried real hard. It's fun. You guys are making me think. She wasn't supposed to take a picture of the baby yesterday. Like they say, don't. I think because they sell them to you. So like if you go, and I think that she put it up. Let's see here. That's funny. How do you find like who you're married to on Facebook? You ever try to look? There you go.
Type in her name. Oh.
That's true. That was a good one actually. Honest teacher responses. There you go. Okay, type in her name, right? Duh. So, oh yeah, she took that freaking picture.
Just like you.
Isn't that insane? And they're a year apart. They're like 10 and a half months
Look at
apart.
those eyes.
Yeah,
Oh my
you see it,
God.
that's your eye.
And neither one of us have, like, I got maybe green and she is brown or yellow, but that's funny. All right, so that's what she wasn't supposed to take a picture of yesterday. But this is the ultrasound. I think she just snuck her phone, like, and it says no photos in this because they want to sell them to you. They're like, cool, you want to see what your baby looks like? Give us $50.
Nobody wants to see that.
So that, yeah, that's kind of the ultrasound. What all do they do? But yeah, that's a pretty funny. They do look like twins, but they're 10 and a half months apart because they're Irish twins. And anyway, so your ultrasound, they'll try to sell you everything you ever do in your life. And what's that? The son is the youngest right now, and then girl's the oldest. Did I ever tell you guys that story though?
Mm-mm.
Her brother married us as he was a priest,
You told us.
and we got pregnant before the wedding, so we had to go to confession to him.
What?
And he was cool about it. He's like, I'm excited for you guys, and I have a baby, but it was before the wedding. So.
Wait, so she was pregnant like in the winter? Was it like noticeable?
No, it was
Okay.
2 months.
Oh, that's
And it was her first, but when you have your second, because what is that called? Uterus can move quicker. So your first you won't notice. The second one, it's the uterus moves fast, and now she's like already up to here. But she did have to change it though. You also like go from like a or a B to a C or a D. So she had to get that tailored, and her brother didn't give us crap. Here's other birth complications. So other things I can't totally pronounce, but like, getting to know prolonged labor is a big one. That's the last one here. Perinatal difficulties, like if your cord is wrapped around your neck. Any of you guys had that? My brother had that. And that can like strangle you or cut off the blood supply. Conium aspiration and potential respiratory complications. So that's like breathing in the fluid that you're supposed to be born in. You don't want to get that in your lungs. If it is, you suck it out. Some other ones. So low birth weight could also be under 5.5. Also prematurity. So actually we had one dude at 37 weeks. So I guess he was technically premature. But anything less than 38 weeks you could have challenges. You could like have to do extra stuff. Intrauterine growth retardation. So that's prenatal deprivation that retards the growth. Also increased risk for developmental disabilities. And we as social workers need to support the parents. So there's like, have you guys ever heard of Help Me Grow? That's one of the social work agencies that goes out for premature infants and like helps them develop properly. That's one social work job that a lot of people like. Here's some of the consequences of premature birth. So like your lungs don't fully develop. Like if your lungs aren't all the way developed to 38 weeks, it might cause respiratory distress syndrome or RDS. So there's treatments that can be provided with caution to avoid complications. Retinotherapy caused by higher oxygen levels, and then RDS kids can be placed on ventilators. I had a friend this year. He got married in October, and they got pregnant like on their honeymoon. So this happens a lot. And his wife's from South America, and when flying down, it got sick, and they had to deliver the baby at 20 weeks or 21 weeks. So his baby's been on a ventilator for at least 2, 3, 4 months. I guess it would be technically, it was supposed to be born next month, but it's been out of the womb for 4. They do have ways to save those babies now, but it's definitely not always smooth sailing. So psychological dimension, they do say the fetus responds to pain, touch, light, and taste. So like the baby can hear you in the womb. Well, there it is. At 26 weeks, it responds to sound vibration. What's that? Did it charge? Does it actually charge? It's just taking all your battery life. I use that on this, but mine, like, my battery stinks on that thing now. Is that a MacBook? Okay, so it's probably got a better battery. It's probably got a better battery. I found this for a few hundred on Amazon. Don't they give you guys computers if you ask for one to the loaner system?
For renting and stuff.
Are they any good? Like, do they suck or are they good? I feel like they're all like this.
Yeah. I got my MacBook on scholarship, so.
Okay, all right. That's good.
You said what? No, I worked at a summer camp for like 4 years all throughout high school, so we would go out in the summer and we would work, and whatever we worked, we got like a stipend, so we would get like $200 for 2 weeks, and then they would match that in scholarship money. So once you're a senior and you graduate, they gave me like $800 to buy whatever I needed.
That's nice.
I got lucky.
Well, computers went up this year with inflation, so like.
MacBooks are just overly expensive. I can't use it. They're too little too.
They are little. The only one I can afford is too little. It's this one. But in the old days, they're a little bit better.
I don't like how little they are. I don't like the little computers.
Yeah. It does function. But all right, we'll get through these 2 slides and then I feel like we're on pretty good pace. What's that? It's possible. Because it's half online, right? You can look up the stuff. You can read the book online. You can do all that. You can work on your assignment. Huh? Is it digital?
I got 2 books physical, but I don't even know what kind
I
of
don't even read the book. I ain't gonna lie to you. I ain't even fake to you. That's why I come to class.
I did that in college. I did make it through. So, and this is everything out of the book. This is like chapter 3. It's true. At some point, it does help. Or so what I did in my doctoral program is you did have to start reading in graduate school. I got the digital book, and you could scan it in and have Siri read it to you.
Now, if I really gotta read the book, I'll read the book.
Voice to text.
For some of my classes, I don't even need to read the book.
Right. That is the case in college. I'll never tell you which way to do things, but when I got to, if I did not read it and I would fail, I would use a scan, and then you can have the computer read it to you. I just pop in headphones and I'll just like go run and listen to the book. Or go to bed and listen to the book. Like, so what's that? Oh, we don't have one?
No.
That's what I was telling you. They say it's only in store.
Really? Oh, but they'll give it to you, right?
And I gotta return it. What's it called?
Right.
It's rented.
It is called Ashford, Human Behavior in the Social Environment by Ashford.
You order books?
I think yeah, and I got 2 and then
We may have one upstairs if you guys all wanted to share it. I'll get you after class if you want it. But you have, did I send you the PowerPoint yet?
yeah, I think it's posted.
Okay. I tried to send you guys. Where's the other stuff they look for? Babies can hear you. That's why at birth it recognizes mom's voice. Mother's emotions affect the fetus. This is a big one. Like if you are in a domestically violent relationship and always stress hormones going through your body, the baby absorbs that. Like, and domestic violence increases by a large percentage during pregnancy for whatever reason. There's just a lot of research on that. Maybe they don't want to have the baby, or they're scared and they're fighting because there's not going to be enough money. But mother's emotions affects the fetus. So depression and anxiety are related to lower birth weight. There's research on that. 10% of the time after the baby's born, they're spent in quiet alert state. That sucks. That means 90% of the time they're either crying or sleeping. The sleeping part is fine. And then they learn to recognize when a baby's had enough, particularly in the NICU. And then they'll do different assessments to see how well they are. Like their eyes suck, but they can see about 9 inches, and that's for like if they're breastfeeding, they can look into the mother's eye. So it's like nine inches away. Did I say 9 once? They can see 9 inches. So they can focus on objects. They prefer contrasting complex patterns. So they would like the pillows in your all's chairs there instead of like my boring ass shirt. They like, this checkerboard or like the ceiling or the lights. Like they kind of focus on.
Isn't that why they do like that sensory stuff? Like where they take the babies and put them in a pool full of like Orbeez or something?
Yeah, that sounds right. They try to get everything stimulated. So they prefer high-pitched sounds. So you'll talk to them like, "Hi, how you doing?" Instead of like.
Yeah, I heard that's bad for them though. Like talk to them like they regular people.
True. But it might be why they like a female voice instead of a male voice.
Yeah.
But I'll like fake a female voice and they think it's good. Hi. But you're right. You should talk to them normal. I guess I'm not making my kids too messed up yet. But my one is learning how to talk right now. And he says chicks. And then I was like, we'll go back, look out the window at the chicks. He goes, she's, and he'll like run, and he'll do that 10 times a day until he's tired. So he just wants to see the chicks, and we'll throw corn, whatever the dry corn is out to him. They prefer sweet over salty, almost like we do. And you prefer acidic, over salty, acidic, or bitter. So we like sugar. That's just like human. And they can imitate your facial expressions. Like if you ever mess with babies, they'll do like, how old is she?
1.
So you're seeing some of that? Okay. Anybody else have nieces or nephews or a baby year round? How are they? Crazy, loud, annoying. What's that? Yeah. Yeah, that's the one hard part about having them in your 40s. You're like, I want to go to bed, man. They're like, yeah, and you're like, I want to go to bed. You can't do it. You ain't going to bed. You ain't going to bed. So, my wife does try to stay up with them. She's finishing school here and quit working when we had them. But it's with inflation, it's hard to live off of one income. I'm not going to lie. So last bit, attitudes, emotions. So colic is prolonged bouts of crying, and that's the baby 3 hours or more for, what do they say, 2 weeks to 4 months of age, peaked around 6 weeks. So the rule of 3, it's 3 hours, 3 times per day, 3 weeks. Okay, that's it. So crying occurs more than 3 hours a day for more than 3 days per week and longer than 3 weeks. So like they're crying and crying and crying. That's why they also say never shake a baby. Some people will be like, stop crying, and you can give them brain damage. So they have, yep. So that's tough, like you've got to find ways to soothe them, and like meet their needs if it is hunger, tired, whatever. And, but sometimes you get so frustrated, you're like, stop, and then a baby dies. So you can be charged with like something, I don't know. So organic causes of colic could be like constipation, lactose intolerance, meningitis, or even abuse. So if they're getting hit, primarily the cause of colic is gastrointestinal, psychological, or neurodevelopmental. So this is a good stopping place. I still wanted to show you 30 Days of Heroin in Cincinnati real quick. Did any of you guys watch that last year ever? Like, I know those of you that had me in class. Anybody aware of our heroin epidemic in Cincinnati?
Is heroin different from like opiates?
It is an opiate,
No,
so
it is.
it's classified under opiates.
I know, like last year, I was really like obsessed with like looking at the jobs for like people who like
Or social
go
workers.
in. No, like where people can go to like hospitals and like hold the babies that are like the opiates.
Right, the neonatal unit.
Yeah.
Did
I
you
think
see?
that's so cool and like so sweet and so
Mhm.
nice, but it's so sad too. I did a lot of research on that.
Yeah. So they harvest the heroin in Afghanistan mostly right now, some a little bit in Mexico, and it's a flower, and they just cut it and take the and then dry it out and turn it into powder. So people either snort it, shoot it, or smoke it. Fentanyl is fake opiate. It's like a synthetic opiate. I don't even know how they make fentanyl. I have no idea. It can kill you fast. Right, right. And it could be in the weed without knowing it. That's the one scary thing. It's like, how do you know if weed is laced with fentanyl? We had that in Cincinnati twice this year. Did you say what? I'm sorry. Fentanyl? Did she die? Oh. So they found the person?
Yeah.
So she just smoked a joint with fentanyl. Damn. What city is that? God. Is that like a way like they try to turn crappy weed into good weed by putting a little fentanyl in it?
Maybe,
I don't know why else they would like waste their. So here, the intro gives you what this is about, and then we'll stop it for next week. But this is.
Babies will be born to heroin-addicted mothers.
Wow.
Courts will take children from addicted parents. Taxpayers will spend heavily to lock up drug users. People will overdose in gas stations and parks and school parking lots.
Bianca and Kieta.
It's the first day of another week of the heroin epidemic. Over the next 7 days in greater Cincinnati, at least 180 people will overdose.
So that's your little trailer. We'll watch that one next week. Who?
For the 19th, but I didn't know we had to submit on your end.
You can just sign a sheet. You guys have a piece of paper?
Okay, so this says I have to upload a file to submit.
Oh, right. That was the online one. If you just put a Word document that says I'm here, you're good. And then sign in here too. So either way is fine.
Okay. That's just that genome.
The genogram? Oh, you're trying to buy the software? Yeah, I know. It's kind of ridiculous. I just draw it by hand. Look, he's drawing his already. It's looking good. You want to show him what you're drawing? You got the good skeletal framework.
Man, it's a little something. Man.
Yeah.
I gotta add a key. I might add some color into it. But I made a key with like people that went to college, like Bad Litter, and then
It's better than the software. Yeah. It's better than the software. She's.
Which makes me want to
Don't buy it. Don't waste your money.
It's not as hard as you think.
I don't know my dad's side of the family.
I don't know my dad's family. I
Just do what you know, and it should be okay. Any questions about anything? You guys okay in all your classes?
I don't.
How's it going?
Natural disasters kick my butt.
Do we need to look at this again? Are you guys okay on this so far? 30 hours a year? 15 hours a semester? All right.
Is that the new one?
I don't know. The secretary will send it though if you ask for a new one. Social and behavioral science, like against the wall, you straight back and hit that
I
wall.
think that's the new one because my advisor says that's the new one, like, you have to take computer science.
It's not a ton change. The main thing is that
Yeah, that's what my advisor feels like. The people, the freshmen coming in now, theirs is not the same, but they have to add like computer science. That's it.
like the main difference is
Because this is the second time they've been doing this. So freshman year, they said you only have to take one math class in social work. But then they changed it to 2.
no language. Is it 2 maths?
Yeah, they told me I had to take, like, my
Really?
freshman year, they said I only had to take 1. But then when I came back, they told me I had to take another math.
Because I always saw it as
Yeah, I took the application, and last semester I just took stats.
Oh, yeah.
Oh, statistics is math. You're right. Okay, that's true. But I thought you meant these two. I was like, ooh. But stats, they make it where you get pulled through in like a group activity if you need to, right? That's how we did it in graduate school.
That was a tough class.
Stats?